We are live, ladies and gentlemen. You're once again welcome to the King Dems Podcast. And today, I have got with me not a fighter, but a doctor. A VIP, actually, in my books, and of course, I hope in your books as well. Please make welcome with me, Dr. Ivy Uchu Ilonzo. How are you, Ivy?
Well, thank you so much for inviting me to your podcast, and I'm so glad to be here. I'm doing great, and I'm happy to see you again. It's been a while.
Wow, it's been a while, like a long while. We've got history. I remember meeting you during NYC
Yeah.
program, and I always remember the first day I met you because I think you were doing some documentation, and some people were asking you, "Oh, what school did you go to?" You mentioned your school, and they were like, "Oh, where is this school?" And you're like, "St. Kitts," and you're like, where the hell is St. Kitts? I think the person was asking, is it a Catholic school? And I was like, excuse me, don't you know St. Kitts and Nevis in the
Mhm.
Caribbean? And you looked at me and like, wow, do you know that since I came back to Nigeria, you're the only person?
Yeah, exactly.
and, and he gave me the most genuine hug, like, brother, you're a correct
At
guy.
least
You're a correct guy.
someone knows. At least.
At least finally somebody knows St. Kitts, right? It speaks to the level of would I say arrogance that comes with ignorance,
Yeah.
with people in, certain parts of the world. Like, come on, St. Kitts, yeah, it's a small island, but come on, your geography.
Yes.
Your
And
geography
it
should be on point.
And it should be an opportunity for the person to actually know about the place. So if
Hmm.
someone mentions
Hmm.
a place somewhere you've never been to or you've
You
never
don't
heard of,
know, yeah, you
yeah, it's
should be
just
curious.
yes, and be more not to criticize or mock it, just ask questions and be more enlightened.
Exactly, exactly. A curious mindset is actually important for growth and self-development. And I think that is the reason why we have been able to, would I say, grow over time and, of course, still reconnect, even though we have been on different professional and business trajectories.
Yes,
Like
yes,
minds, like minds will
hmm
always connect, right? And of course, they say the
yeah,
real recognize the real. And of course,
exactly.
I I have
Mhm.
always appreciated you. I appreciate your talent, your craft, your profession, your discipline. It takes a lot, to be a doctor. I always tell people I don't want to be a medical doctor, but probably I will still be a doctor someday down the line. A
Mhm.
PhD doctor,
Yeah.
not a medical doctor, because I do not want to swear the Hippocratic oath. it's it's a lifetime of too much responsibilities. It's a lot. So I appreciate you guys, in the healthcare field. But your own journey has been inspiring. And, at what pivotal moment in your career did you realize that proactive healthcare and women's health advocacy were your own true calling?
Okay. I know, I guess the cliche thing would be to say, oh, when I was a child, I've always wanted to be a doctor. I know all
What?
that normal stuff.
Even my own mother wanted me to be a doctor. What?
But I've always been interested in healthcare, and then outside the healthcare, I've always been interested in like women's stuff, either beauty, skincare, women's health, and everything. So as
Women
I
supporting women.
yeah, so as I grew older, I went into medical school, and then I started realizing that there was more to women's health than that I knew. Also got me exposed to know about the mental health part, the physical, and then obviously like health issues that women go through. And so I saw a lot of cases where preventable health issues were ignored or misdiagnosed, or not really paid attention, were not really paid to them because of either lack of awareness or something. So I just realized that if you don't educate people, if you don't tell them about these illnesses, or if you don't tell them about these conditions, you will just find out that they're suffering for something that is actually preventable. So this made me want to go, this drove me to go into health promotion. We call it health promotion in public health. So health promotion or health education, either through my coming book or through social media. Like I have my platform on social media where I kind of break down health conditions into the simplest form. So it's a way that is more relatable and real, just to kind of educate people on actually what they are going through. And then if they are not going through yet, and just create awareness on habits that can make them go through those things. So that's just to get better health outcome.
Wow, this is really interesting. So I am a finance guy by professional training, but I very much appreciate the healthcare profession. And would I say I was privileged at some point, early in my career to have worked with the Global Fund team on the Global Fund malaria team. So the Global Fund actually has, would I say, uh, they do have some donations to developing countries such as Nigeria. And in terms of these donations, they actually work on healthcare related outreaches, healthcare related programs. So one of those programs was the Global Fund Malaria, and there was Global Fund HIV and Global Fund tuberculosis. I was on the finance team, but I did, have the opportunity to see the programs, the workings of public health in action. And I was exposed to certain very, would I say, for the lack of a more sane and polite word, very ridiculous stats, wherein we know how much malaria medication, anti-malarial medication, for example, costs, right? In Nigeria, they probably cost less than one pound or $1. But you see that certain individuals actually suffer from cases of chronic malaria, severe malaria, right? And you have unnecessary fatalities and mortalities in, these developing countries. It's really, really sad to see. And also a lot of these diseases that are prevalent in the tropical regions, right, are easily combatable when you adopt, the simple health tips that, fantastic individuals like yourself actually preach, or what I say, do a good work in publicizing. So it's really, resourceful having, individuals like yourself who are well educated and who have, would I say, humanitarian a mind as well, giving back to the society. So, but you have been able to successfully blend medicine, public health, and technology. But how do you see these three fields evolving together to shape the future of the global healthcare scene?
Well, I would say the future of healthcare involves integration of these three parts. The reason I say so is the medical aspect, that gives room for the clinical foundation. So because you have to have that clinical experience, you have to have that foundation to be able to reach a wider population. So now reaching that wider population comes with public health. Right. So all these they all have to come together to, like, we have to put them together to be able to create more global impacts instead of just that whole one-on-one patient result. So we have the medical part, which creates the clinical foundation. And then we have the public health, which obviously gives room for a wider population impact. And then now we have access to technology. And it's really, I wouldn't like, technology has really improved healthcare in so many ways. We now have AI-driven diagnostics equipments and all. So let me just break that down a bit for those who don't understand. So in some developing countries, right? Before we can go to the lab for a test, or to the hospital to run a test, and then they may tell you come back in a week time or come back in some days. But now we actually have AI equipments that would machines that would run that test in minutes.
Wow,
and you get the result. Yes.
That's highly impressive. That's
Yeah.
highly impressive.
And you get the results immediately. So things like that now, they have obviously improved healthcare. They've made things that you, instead of waiting for so long to get your results and to know the diagnosis of whatever it is, you can get that faster now using technology. And then we also now have access to things like telemedicine. You can actually have video consultations instead of having to go all the way to go see a doctor. But the most important thing is we also have to understand that technology should not create more gap in health inequality. It should bridge it. So why I say so is you may find out that it may be a certain class of the society that will have access to those technologies. But we're looking forward to a world where everyone, no matter the class, will be able to have access to the same level of healthcare. So both the lower class in quote and the upper class can have access to that quality of healthcare.
Interesting. So I guess we are actually speaking from a global perspective here, looking at both the Western world and of course the developing world. We are fortunate to have to be individuals who have would I say our ancestry and heritage, from the world's most popular black nation, which is Nigeria, which unfortunately is still classified as a developing nation. I think we can look at it from the brighter side. We are developing. Why is it called a building when it is already built? So it's good. We are developing, not underdeveloped. That is, a more
There's a
negative term.
difference. Yes.
There is a difference between developing and underdeveloped, right? So, it's been a while since I've actually been in that health care scene actively. So I remember participated in the Global Fund Malaria Grant, being opportune to have seen the impact of the programs, right? The sensitization, the would I say the workshops as well, the outreaches in rural areas, right? They were performing activities like would I say providing anti-malarial medication to less privileged individuals in rural areas, also providing the LLIN, that is the long-lasting insecticide nets, right? So what is the current landscape in the developing nations, especially in places like Nigeria, from global grants, donor agencies, the likes of your Global Fund, the likes of your Bill and Melinda Gates Foundation, the likes of your USAID, right? is their current what was the current landscape, just a bird's eye view of what they're doing in order to ensure that initiatives like what you have discussed, like ensuring coverage and capturing um even the less privileged individuals, ensuring that they are able to benefit from technologically driven initiatives. Is there anything that these guys are doing, and what call to action would you give them?
Okay. For I'll just try not to seem harsh to any side of whatever I'm trying to say. Firstly, I think for a developing country like Nigeria, they have to invest a lot into education and awareness.
Uh-huh.
So for a country where you have so many ethnic groups and with different cultural beliefs and also religious beliefs, you first of all have to break that barrier of cultural believers. So you have to first create cultural sensitive education, something that would be appealing to them, to get them to be interested, to want to know. Because there's this attitude of waiting for something to happen first before going to seek for care. So when you want to eradicate something like malaria, if you don't want to be overwhelmed with supplies of nets, supplies of this, supplies of that, the people you're supplying to, if they don't know the reason why you're sending those things, they're not going to make use of it. If they don't know the benefits, if they don't know the importance of those things, they won't take it as serious as you would expect them to.
That's
So
actually very true. I'm so sorry
yeah.
to interrupt you here. So sorry. You just reminded me of some cases I see here of, certain individuals collecting the long-lasting insecticide nets and now going to the market to sell it.
Exactly.
They've provided you with this
Exactly.
handout that is meant to help your health, but then you're like, okay, why do you care so much about my health? Want
Exactly.
to monetize it? It's
Exactly.
I don't know. I don't know. I'm out of words actually to explain or to try to decipher what is happening in this kind of situation.
And also, from what you've just said now, I said I don't want to be harsh on both sides. So you have to consider the middlemen, the people you're using to implement to implement, because if USAID may not always be in Nigeria, so they have to use people in Nigeria to carry out
Yeah.
the charity. So now you have to find people who have empathy, who understands the importance of what you're doing. They're not thinking of themselves alone, but they're also thinking of the people, the community. So now, for example, if you meet somebody, if you're going to use someone who is thinking of the money as a middleman, they're going to monetize it, and they'll want to sell it off. So now you're sending it to a developing country or a part of the country where they're not financially buoyant, and you want to sell something like that to them. If they are not sick, if they are not sick, they may not buy it, because they will
So,
want to wait till there's a problem before they buy it.
so I think I was kind of, would I say, a bit close to the details, right? Because of the fact that I worked with Catholic Relief Services. Catholic Relief Services, they were an agency that were involved in implementing the grants. So you have the donor agencies, the likes of your USAID, the likes of your Bill and Melinda Gates Foundation, the likes of your global funds, right? These guys have good initiatives, good intentions, and they partner with, local NGOs, who are like the primary recipients of the grant, right? So these guys sometimes even have like sub recipients of the grant, right? in order to implement the programs. And they have access to local staff, uh, local leadership, right? They perform a lot of sensitization and awareness programs, right?
Mm.
They provide these, would I say, handouts, right? Such as the nets, the medicines, right? To these individuals. They even try as much as possible to ensure that uh, it is provided to individuals on a need basis, right? However, some of the locals, some of the indigenes, right, would I say probably take these initiatives for granted, right? And we are not saying that there are no cases of probably some corruption amongst maybe local staff members, right? But at least these international, organizations do their best, right, in order to ensure that, the implementation of the grants are actually properly supervised. And also, I was privileged to actually be an auditor as well, at PwC, PricewaterhouseCoopers, you know, being one of the global big four audit firms, right? We also come in as independent third parties to supervise, you know, and, be a watchdog regarding how these, grants are implemented. Despite the checks and balances, unfortunately, the people that we're trying to help sometimes do not want to be helped.
Mhm.
So I don't know how you guys who are experts, you are the public health expert. You are the one who has that, appropriate training in terms of making, individuals who would I say lack a requisite education to understand what is in need for them in terms of these initiatives. So I think I would appreciate you coming in from, that public health perspective, right? I am just a finance guy. I only know numbers. If it's not, articulated in numbers, it doesn't make sense to me, right? But you are somebody who is, probably closer to the field, who understands the nitty-gritties of how to help the public, in terms of these health initiatives. So what's your perspective on these issues?
I First of all, I actually want to commend the uh polio project they carried out in Nigeria. It actually has really improved the eradication of polio in Nigeria. I really commend that. And then in terms of how to be able to reach those difficult, like hard to reach population, it's by just creating culturally sensitive materials in various languages as much as possible. And then the use of influencers. So, not social media influencers. So every community, they have someone who they look up to. They have someone who is either the king of the king of the community, or their chief, or their religious leader. If you're able to get so if you're able to educate the leaders would be able to then educate their members. And that way they trust those people. They trust that they will tell them something right. So they are the ones that will be able to reach them faster. Because there's this general notion about healthcare or medicine. Some people feel like you're trying to experiment on them. Some think you're trying to. It's just this mistrust when it comes to healthcare.
Conspiracy theories.
Yes, yes. So, but if you want to actually get to them, you have to find someone who they listen to and who they trust, and that will be the easiest way. Another way is, if you notice, during the COVID time, enforcing policies that would enforce COVID, like COVID vaccine, were kind of put in place. A lot of people actually had to take the vaccine because movements were not really easy without having the card, the vaccination card. So policies like that too can also help. But I feel like you don't really need to, especially for something that would benefit me, you don't need to force me to do it. Just tell me why. Help me to understand and see reason why you want me to do it, and then I'll be able to do it. I feel it's a better approach than creating policies that would force people to do things.
Oh, I think that actually makes a lot of sense. It does make a lot of sense to me. But in your experience, right, what are some of the biggest misconceptions that people have about women's health? And how do you work to debunk these myths?
I think the first one I would say is everyone thinks infertility is just a woman's problem, but it's not.
Whoa.
Yeah,
You're
it's
shaking
not.
tables. You're shaking tables right now. Doctor,
So, so 'cause every time
Yes,
they
ma'am.
just maybe you see a couple, they're trying to conceive, and they're like, okay, they've been together for 10 years and they don't have kids. Everyone just starts looking at the woman or starts pointing fingers at the woman. But actually, infertility is not just a woman's problem. It can either be the man or it can be the woman. And I just always want to say that because I've noticed people just, if the woman checks herself and she feels, after doing all the tests and everything, she feels that they say, oh, you're fine. She starts thinking it's spiritual or, just, well, instead of also checking the man, they just conclude that it's spiritual and some superstitious beliefs and all that. That's one. I'm very passionate about bleeding disorders in women. So I always say that heavy bleeding, heavy period or irregular period is not normal. So some people just think it's a normal thing, but it's not normal. And then I always also say that menstrual health or reproductive health shouldn't only be looked at when someone wants to conceive. It's something that should be looked at from the beginning. And my own way of combating all this is by creating more awareness, educating people, like making noise about it, telling them on social media, my book, my blog. I just keep talking about it just so that people would know all these things. Because you may think you know, but you find out that a lot of people out there don't know.
Now, something that really struck me and struck my interest was what you said about menstrual health. So, from my own personal experience, I have been able to have encounters with individuals who have actually suffered from bleeding disorders, who have had, irregularities in terms of their menstrual health. Unfortunately, most of these individuals are actually, I say, very ashamed to speak up about these issues. And I know a certain individual who had a life-threatening situation before she could speak up and, was able to now have a conversation with a doctor friend of mine. She's provided, some sort of guidance and she had to do some sort of surgeries and procedures, right? However, in my own data analytical head, I feel like if this person had spoken up earlier in time, he shouldn't have, metamorphosed into such a severe situation. But what do you have to say in terms of the required, what I say, mentality and orientation for women to be able to speak up and, not to be ashamed when it comes to these things? I don't know why it feels embarrassing to them. I'm not a woman, so I cannot speak for women. Thankfully, you are a female. I think you're in a better place, not just being a female, but also being a certified, qualified, and experienced health professional. What would you say regarding this?
I am so glad you've asked this question because I don't know, I I keep mentioning the book I wrote. Writing that book gave me a chance to actually dig deeper into this question you've asked. The reason is the book is mainly about the bleeding health in women, bleeding disorders in women. And then I found out that most of the the main cause of the shame. I don't want to use the word shame, but it's unfortunate that I have to use the word shame. It comes with talking about menstrual health. Actually, comes from the community or the society. So I found out that even till date, there's some societies that see menstrual health as a taboo. A woman may be restricted to do some things if she's on her period. Some people use the term she's unclean. So when you keep hearing when you're on your period or when you're on your menstrual period, you're unclean, it's something you want to hide. You don't want to tell everyone about it. You don't want to say anything. So now, when you now have a bleeding disorder, the idea of menstrual health is already something to hide. Then now having a bleeding disorder makes it worse. And then if you're surrounded by people who think that saying you have a bleeding disorder means either you have infertility problems and all, you're also afraid to face reality, so you want to keep quiet, you want to hide it. I've seen so many cultures, I've read about so many cultures where the girl is like, once they're on their period, they can't go to school. So now if you check it every month for 6 days, they have to stay away from school just because of their period. They don't want to see, and then they can't stay around male when they're on their period. I don't know if you've ever heard, if a man touches you, you will get pregnant. There's some things like that. So it's like
ridiculous statement.
They have to just stay away. So it's something that they have to hide. And then I've seen relationships break up because the woman found out she had fibroid. The man already starts thinking, oh, she's not going to be able to give birth. No, I can't get married to this person. I have to break this relationship up. So that's fear. It's just the way people react to it makes them shy. In some countries, I don't want to keep on saying Nigeria, some countries, a man cannot just go to the pharmacy and buy a sanitary pad for their partner because they don't want to be seen holding the sanitary pad. What's there? But you can hold the toilet paper. Why can't you hold the sanitary pad?
Yeah. So for an individual like me, I see that as very, very unacceptable. Maybe because of the way I grew up, right? So when I was younger, my mom did a really good job with, her male children. She always ensured that, we take good care of our sisters, and of course we take good care of her as well. She would send me and my brothers to go buy her sanitary pads, right? So I don't see it as a gender-based role. But I've been in situations, where I go to the shop and then, I'm asking for always, and somebody's looking at me with a funny face. I'm like, I don't care. I don't care. Yeah, I am paying in full. You have to give me that thing. It's not only females who can come by always or buy, any brand of sanitary products, right? I think there is that need for sensitization, across board. But it's interesting that, I've been privileged to live in Nigeria and also live in the United Kingdom. And in Nigeria, yeah, I know it's quite severe. The the backlash or the would I say stigma that is attached to these kind of conditions. even in the United Kingdom, where people seem to be, would I say, more open about these things, people still uh, are ashamed of speaking up about it because I've been privileged to know about, people who grew up all their lives here and have had, these kind of conditions, but still find it difficult speaking to medical professionals seeking medical help. In the UK, you have the NHS, right? Uh, Healthcare conversations are more confidential, right? However, why is it difficult for an individual to at least just speak up, call the NHS helpline, call your GP, go to the A&E if you have any issue? But we have had, cases of, severe casualties from these kind of easily, would I say, addressable issue. Like, why?
So, for something like menstrual health now, the period comes every month. So if someone has, let me say, heavy bleeding this month
Mhm.
and it stops, they don't have to bother again till the next month. So it's just that mindset of, well, it will come and go. I'll
Whoa.
just manage it. I'm just going to deal with it. If it's something that is, once it comes, it's life-threatening immediately, you see that they would run more to get help. But if I've had situations where if someone is having like dysmenorrhea is called painful period,
Mm.
and they're going through pain, just take just some painkillers, you'll be fine. They don't even want to know why they're having that painful period. As long as once they get better, they move on. So it's either the people around them have made them feel like, okay, it's a normal thing. There's no, you don't need to waste your time calling the GP. Just after some days, it will go off and you'll feel better. So that's the thing. I would really like to let people know that it's not normal. So have heavy periods, have irregular periods. It's not normal. Because this thing happen every month and after some days you feel better. That doesn't make it normal. So speak up and go find out what's causing it. And that way you won't have to have it continuously.
Okay, I think I might have to borrow some lines from the TFL. If you see something that doesn't seem right, please speak to staff or call British Transport Police on 61016. See it, say it's sorted.
Yes, yes.
So, see it, say it's sorted, actually, literally. So, when it comes to global health and, preventive medicine, the WHO, that's the World Health Organization, reports that 60% of health outcomes are linked to lifestyle choices. So, what are the most preventable health conditions that people neglect, and how can they take proactive steps to avoid them?
I would say the ones that are out that are non-communicable. So for instance, things like diabetes, hypertension, or any like the heart diseases, people just because it's not immediate, they don't pay attention to it. And so it's actually these three, they're actually tied to lifestyle a lot. So if you're not aware of it, you'll make lifestyle choices that would eventually lead to that. And then if you also sometimes, like for example, we talk about sugar intake and all that, and then the person would actually think, when that happens, I'll take medication. But the truth is, the mental impact of having to depend on medications for the rest of your life is a lot harder and a lot worse than actually choosing a good lifestyle to prevent it. So it's better to prevent it than to be subjected to a whole life, like to the rest of your life, taking medications just to treat it.
Oh, so in terms of this non-communicable diseases, right? The WHO also says that the non-communicable diseases account for 74% of deaths worldwide. So, what role does preventive healthcare play in reducing these numbers, and how can individuals take better control of their health?
Actually, for non-communicable diseases, preventive healthcare actually plays a very, very important role in that. Reason being that if you make decisions or if you make lifestyle choices that would help to prevent it, it would reduce the mortality rate of those diseases. So simple things like the first thing I always want to say is know the family history. It all comes a lot through family history. If there's family history of hypertension, family history of diabetes, you would definitely know not to pick lifestyles from just because someone else is doing this, I'll do this. No, you have to also know what's good for you personally. So having some simple lifestyle like checkups, check your sugar level, check your blood pressure, check your that make sure you have balanced diets, balanced nutrition, exercise, don't be sedentary and all. That would go a long way to help to reduce the mortality rate and also to prevent it. And then even if eventually they get to have it, also having like it's good now. Before, in like so many years back, to check your blood pressure, you would have to go to the hospital to check your blood pressure. But now we now have things like this. You can do it yourself at home. You can check your sugar yourself at home. So if you feel like there's you know there's some symptoms that if you start experiencing, you kind of be like, okay, let me just check my blood pressure. That things like that can also prevent stroke and some other heart attacks and some things. So it's always good to first of all, be aware of it and then make the decision to change your lifestyle and also take proactive actions. What?
Well, speaking of lifestyle, right? For me, being a numbers guy, I like wearables like the Apple Watch. I personally do not like would I say accessories or jewelry, but I had to force myself to make my Apple Watch my best friend. So I track my fitness activities with the Apple Watch, and I think yeah, it gives you like relevant data. Because for me, I like to make it make sense in numbers, right? You get this reports, the weekly reports, the daily reports. Think at the end of yeah, this is a new month. I did get a report from last month that I had an average would I say number of minutes of exercise in the last month of about 20 minutes a day. I'm like, okay, is that a good variable, or what is a good number for the average individual to target in order to ensure um yeah, a healthy lifestyle?
I would say first at least 30 minutes of exercise a day. That's at least it's okay. It's not too much. It's not too small. 30 minutes is okay. And then have at least 7 to 8 hours of sleep a day.
Mm, 78 hours of sleep. How many people in the comment section actually have 7 hours of sleep? You're entering people's gardens.
I need to, because some people actually don't sleep by choice. So
Oh, wow.
that's why I need to get into maybe they're watching series or something or movies. So they don't sleep. But yeah, I understand the fast-paced lifestyle in that we have now because of work and other responsibilities may not give you the chance to have 8, but I say at least 7. 7 is not hard to reach.
Okay. So, but I do have a question. Anytime you talk numbers, my head is, it's excited. So, 7 hours. Do these 7 hours need to be at a stretch, or can it be broken in installments? So probably you do 6 hours at night, or you probably have maybe like a 1 hour siesta here and there during the day. So, and I also understand that there's a difference between regular sleep and deep sleep. Deep sleep is a higher quality of sleep, right? And that is what actually helps the brain
Body.
to re-energize, and the body as well to rejuvenate itself. So I'd like for you to, shed a bit more light on sleep, because I do appreciate sleep.
Yes, so I personally recommend, like, if you can have that stretch, yeah, please go for the stretch. Let it be that maybe the breaks should come once in a while, not like, let it not be a routine. But if you're able to get a stretch and go for a stretch is better. So it gives the body time to, like you said, to rejuvenate and or like to work on itself. But if you're breaking it, it's just I don't know.
So
It's
it's not
not
as
enough.
effective, right?
It's not as effective now. So it's just always good to like have that stretch. And later on, if you want to have like quick naps here and there, that's fine. Or a stretch is a good one. It gives you, and when you actually get up, you feel refreshed. Than for if you notice the shorter ones, the quicker ones you have, yeah, you may feel, but not as refreshed as when you have a longer one. Your body
Yeah.
feels, yeah,
You feel like you just charged your battery to 20% or 30%,
yes,
and then it gets
exactly,
drained again.
exactly.
But I've seen, some body of work in terms of research. For me, I'm a data information nerd. Would I say I'm an information junkie to some extent, right? So I have seen certain sleep related researches talking about methods and techniques in order to improve the quality of sleep. And for all the research work that I've seen, they always, you know, point towards improving the quality of deep sleep and achieving a higher number of hours of deep sleep. And of course, there are even certain machines that have been built such that, but they are quite expensive, such that if you put an individual inside that machine, the quality of sleep they would achieve within that particular machine is actually better than if they were on a regular bed and pillow. So are there like health tips you can give to, uh, Tom, Dick, and Harry in Birmingham, London, and Manchester who cannot afford, the latest technology in healthcare, right? But, practical tips that you can, provide to Obina and, Ade back in Nigeria that would actually help them in terms of improving the quality of their sleep.
Well, I'll first of all start with keep away the phones. Like,
Mm.
try to stay away from your phone when you know you're gonna sleep. And then the idea of having television in your room, if you can do away with having television inside the room, that would also help. Let the bedroom be for sleeping. Let it be for actual sleeping. Keep away from phone. Just know when you get in there, just know that, okay, I'm in to sleep. So that way, you'll be able to get that good sleep. But the current habits and social media addiction now that we have, people tend to, every time they're on the bed, they're looking at the phones. If they wake up, first thing is the phone, everything. And so the lights goes in and all. So, just stay away from your phone and take out the TV from the room, and then also laptops,
Okay.
and have a good night's sleep.
I feel like you're actually trespassing into my garden, right? So I'll give you an interesting story. So uh at some point, right, I did have, a guest over, and the person invited a friend and the friend invited another person, but there was just an ugly situation in which the TV in my room was stolen and I never replaced it. So they were probably paying me a favor by taking
For
that
checking it out.
TV.
Yes, yes. Because you'd have had
You-
leaked out
I,
movies
I
along.
know, and now I feel like they were obeying your instruction.
Mhm,
And
mhm, mhm, mhm,
I do have a bone to pick with you,
mhm.
but taking the laptop out of the room, I'm sorry, doctor. I'm sorry, doctor. The laptop is always close to my bed. Maybe
You
I will
see?
try.
You
I will
see?
try, so that, I can I can obey your instructions so that, somebody will not come and take it off on your behalf.
Fair. No, no, I don't want him to take it out, but I want it to be safe somewhere, but away from you.
Okay, okay. I think that's fine. So basically, there is a friend of mine who is a physiotherapist. She was on an earlier episode of the podcast, Cindy Hernandez. You know, one thing she recommends is decompression. That is staying away from your phone, social media, technological equipment. Just relaxing and if possible, meditating and working on your breath work and, taking time for yourself to just have that concentrated relaxation. And of course, preferably probably in like a sauna or like a steam bath, which is like usually very good. So what would you recommend in terms of, relaxation techniques and in terms of breath work? Because I think breath work is highly, highly underrated in mainstream, what I say, health care tips, right? So, what do you have to say in terms of, relaxation techniques that enhance the quality of our sleep and, of course, breath work?
Um, I, from the experience I've had and from people I've spoken to, and I would say people tend to speak a lot about yoga. They tend to get good. They feel well relaxed after yoga. So that's just simply meditations and trying finding ways to kind of reduce stress and just be in that zone where you're not worried about anything, you're not thinking of anything. It's just all in yourself, and you just have that time to meditate and think through. So yoga, yes, I've seen how people have good turnout with yoga. In terms of sauna and others, yes, you may have people. So it's not everyone that may have access to all that, but at least yoga is something you can do in your house with or without money. So I always advocate for things that are easily accessible
Say the best
for
things in
everyone.
life are free.
Yeah. So, because I always feel like when you start adding things that are that are costly, it gives people opportunity to make excuses. So you can either say, "Oh, I'm sorry, I don't have that much money for that." So there are other ways to do it. So I always try to recommend things that are not so expensive or things that don't really cost anything, and just kind of have something that is already integrated in their life already, something that they can easily do. Just make some adjustments and then right now be fine.
Oh, it just reminded me of some joke. I heard in Nigeria, they say excuses are always very easy to make.
Mm-hmm.
So they said somebody was telling a Nigerian young person that, oh, Bill Gates and his friends established Microsoft, when they were young. Mark Zuckerberg established Facebook, which, metamorphosed into Meta, right? When they were young.
Mm.
And, what is your excuse as a Nigerian youth not to, create something innovative? And guess what the person said? The excuse is
Oh.
that we don't have light, we don't have electricity. So people will always find a
Always
way
wait.
to
Yes,
to,
yes,
to
yes.
to make an excuse. But yeah, like they say, they say the best things in life are free. But there's a recent song, from I think Tenny that says, money can buy you happiness, money can buy you love, but I
Mm.
want all the money in the world.
Well,
Even
then I
though
still
what even though
and
money
then
can't buy
cry
these things.
and then cry in Bentley.
Yeah, I'd rather cry in a Lambo or a Bentley, Well, let's be real. Money does make things sweeter, but there are actually like
Can't buy
very,
everything.
yeah, it can't buy everything, right? There are very basic things that uh would I say especially in terms of healthcare. So I think I would like to even like give a personal testimonial in terms of like a healthcare issue that I have faced personally. So I did have an accident, in 2021, right? Uh, did have whiplash and, the vehicle somersaulted, right? And for a long time I was seeing, chiropractors, right? But I wasn't really getting better. And of course, I started to see physio. And interestingly, the chiropractors, the physios I was seeing, they were private medical. And you know what private medical is like in the UK. You're talking about paying
First of
about
all,
40, 50 pounds per session, right? And a session is probably like 15 to 20 minutes. So
mm,
it wasn't a joke at all. But at some point, I was referred to the NHS, how we know that the NHS is actually free. And of course, I did meet this Indian doctor, this Indian physio. Then she conducted like some sort of examination on my back, and she touched certain areas, and then she was able to explain to me that the muscles from your accident did not heal properly, and that's why you have certain stiffness, right? And it is a musculoskeletal issue. The muscles are pulling on the bones, right? And of course, you're now experiencing pains in the bones, and of course, uh, muscle contractions that also equates to, you know, excruciating muscular pains. This was extended, from 2021, 22, 23, 24 until 24. Was I able to meet the physio that understood, would I say, the cause behind the effect. And she was able to prescribe appropriate stretches, right?
mm,
And, exercise routines that were able to help me with that. What do you guys call it? Is it that I can't remember the word right now. Rehabilitation. Yes. The rehabilitation process to back to normalcy. But stretches don't cost you money. I was always looking forward to, oh, give me a prescription. Don't worry, I'm gonna buy it. I pay for my
mhm,
meds. But she was like, no, I can't prescribe anything to you. At best, go take your painkillers, right? If it becomes severe. But the stretches are important for you to do. So at that point, I realized that it is very important to take, your exercises, your stretches, which actually aid mobility and agility, right? So you are a doctor, you understand, the workings of the body. You understand anatomy, you understand physiology. I think physiology is the study of how the body functions. Is that correct?
mhm,
Okay,
yes.
so basically, looking at things from a physiological perspective, right? What are those simple things, For example, I've mentioned stretches, which actually does world of wonders. I was at a physio clinic and then I saw something written on the wall. They said, you feel like you're old, but you are not old. The only reason why you feel like you're old is because you don't do your stretches.
Mhm. And then
Uh,
I just thought of something, when you're actually treating a patient, the first thing that comes to your mind is you're not just treating physically, you also have to deal with the psychological part of it. Some people feel they can only be fine, or they get treated only if you give medication. So imagine if you paid 50, you said 50, was it 50 pounds?
yeah, £50,
Yeah,
but I did get like a discounted rate of £40
40
per
pounds.
per
Okay.
session. But that's
So,
still that's
so
a lot of money, man.
imagine if you actually, you paid 40 pounds for 15 minutes and they go back and tell you, go do stretch. You're not going to feel like you got value for your money. You'd
Yeah,
want to go
exactly.
somewhere where somebody would say, take this medication, do this
Exactly.
x-ray, do
Yeah,
this. Like, you
exactly.
just feel like
Mhm.
once they do that, that's when you start feeling better. So, but the lady was able to tell, because going to a physio for years, and then finally you met someone who checks. Yes, it's good that she's also aware of what's actually wrong with you. And she was able to tell you, do the stretch. And you did it. It worked out. So now this is after you've spent so much money. So there are some people who actually believe that they have to spend to get well.
Yeah.
And,
Like
and it's,
more, you see, money talks, bullshit works. There's nothing
so,
money cannot do.
and unfortunately, the private sector, they know that. So they take advantage of it. So if you go
Oh,
to a private facility, they'll charge you for every single thing, and then when you come out, you feel like, wow, they were thorough. Wow, I
yeah.
got the best. It's
I was
better than
like,
government.
see you again. See you again
Yes.
next week.
And the way they would talk to you, they would even spend like hours doing the consultations, checking everything, things that you don't even need to be checked and all. When you come out, you feel confident, like, okay, yeah, I went to the right place. So it's kind of those things. And then regarding the simple things that we can do, uh, like exercise, like she said, do your stretches, exercise, because most times we find out that sedentary lifestyle, we live sedentary lifestyle, and then find out that you get to a certain age, you can't do some things, but you see some other people around that same age doing those things. They've actually been investing in their health.
Mhm.
So they've been doing the exercise. Exercise is not something you just wake up and get good at or get used to. It's something you build. It's a habit. It becomes a habit. It becomes a lifestyle. It's something you grow gradually. Then also your sleeping habits, how you sleep and all that. And I always emphasize on your balanced diet. Just have balance. I'm not in for don't take this at all, don't take that. You can have those things, but have them in good proportions and bits, and just balance everything. Let everything be in proportion.
Hmm.
And
On a
be
lighter
moderate.
note,
Yes.
on a lighter note, you're pushing for balanced diet, but this life no balance.
No.
How do we do that? So, Africa actually faces infectious diseases alongside rising chronic conditions. How can healthcare system balance treatment and prevention effectively?
Um, First, okay, let me start with the treatments. Yes, in Africa, we have treatment facilities where they even have secluded part of the hospital, or isolated part of the hospital for treatment of tuberculosis. And then also we have treatment facilities for HIV where they provide some free medications for HIV, if HIV patients and all. So yes, treatment is needed. Then also the non-communicable diseases, right? To balance everything. Just one way I think it can be done is by making routine screening easily accessible. Routine screening and vaccinations. to make them accessible in down to the primary healthcare. So it's not just it has to come down to the primary healthcare. I do health promotion now, and then I noticed something. I'm just going to keep using the developing countries and developing countries. Cervical cancer, right, is one of the most preventable cancers in the world. Cervical cancer, and ways to prevent it: vaccination, and also awareness, to create awareness, to educate people on it, practice safe sex, and then also routine screening, right? So now, in the UK, for example, screening is free. They send you letters. Once you get to a certain age, you get a letter from the NHS. Come and do your screening. Come and do your screening. It's free. They are calling you, like literally begging you to come. If you don't come, they call you. Please come and do your screening. Come. But in developing countries, if you try to promote or to cause and create awareness around some routine screening in developing countries, the next question is, are you going to pay for it? They have to pay for it. So if you tell them HPV vaccine, so HPV is the high strain of HPV, human papillomavirus, causes can lead to cervical cancer. So there's a vaccine for it. If you talk about cervical HPV vaccine, a dose is, as of that time, as of 2015, is about 10,000 naira. So the question is, if you tell people, go get vaccinated, go do the screening, are you going to pay for it?
That's the next question.
So the only thing I would say is, if we're able to make it universal, like this screening, let it be free everywhere, both developing or developed everywhere. Let screening be free. Let people be able to access screening and vaccinations. Then I think we'll be at a good place health-wise.
Well, I think that's a brilliant, very brilliant contribution towards that aspect of physical health. But I think we've had a lot of talk on physical health. However, one aspect of health that is very, very, very dear to my heart is mental health. Mental health is often overlooked in preventive care. So, what are some practical ways people can prioritize mental wellness before reaching a crisis point?
I think the first part is understanding that there's something actually called mental health. There are some people that don't believe there's anything like mental health. I'm sorry to say, in my country, if you go and say you're depressed,
our fellow Africans, I think African and Asian culture are sort of similar.
That's very similar.
Yeah, they don't tend to acknowledge mental health.
If you say depressed, they're like, oh, wake up. They don't take it serious. So be aware that there's something like then the other obviously where that there's something like, so you would give it a chance. Yeah. Go for therapy. So the main thing is just mental health. And they has a lot of, like, once that awareness how to overcome it, then so there are different ways that you can break therapy, stress, just comes in when the issues awareness will help.
I think I'm actually losing your audio. your audio is breaking in between. That is in between your narrative on mental health. So I wouldn't know if it's
Oh,
due to the
okay.
technological device that you're using.
Okay.
So okay, yeah. So if you could retake your take on mental health.
Okay. So I said
Okay,
the
yeah, it's
first
good now. Yeah. So I think
okay, so the first step is being aware that there's something like mental health. And like the example I gave in some places, if you say you're depressed or if you complain about some certain things, they brush the feelings aside and be like, we're all depressed, so just get over it or go deal with it or something. But if people, the whole, like the society can actually acknowledge that there's something like mental health, that would go a long way. And that way, we'll have support groups readily available where people can go express themselves, talk, and get support from other people who have actually been through something similar. And then also be able to have access to therapies. If you have a therapist, you have therapists available that where one can go and express themselves, share whatever they're going through, and they will get professional advice and professional help. That would go a long way.
mm, yeah, I think that's actually fantastic. Very well put together. Now we're moving into something that is dear to your own heart, which is
Mhm.
women's health and
Mhm.
advocacy. So your PCOS webinar attracted over 200 attendees. So why do you think women's hormonal health issues like PCOS, endometriosis, and fibroids are often misunderstood and misdiagnosed?
First of all, I think those three you just mentioned, the first thing I would say is because they have overlapping symptoms. So they have, when I say overlapping symptoms, it's because they have similar symptoms in some way. So, um, you may not, the person may not see it as something very serious at the beginning. They just kind of want it to play out for a while before, if it starts becoming self-limiting, then they now decide to go maybe do a proper check or go for a proper checkup. For instance, PCOS comes with irregular period, right? It also comes, the same irregular period also happens with fibroid. And someone can have irregular period and it may either be fibroid or it may be PCOS, but they just feel like, okay, if it's irregular this month, next month it may be better. Like I said, because it's a continuous thing, they just want to just write it out, feeling like, okay, with time it's going to get better. Or if they even meet the wrong person, maybe if they talk to if another female there who is not also aware, person may be like, oh, because you're not eating well, go and eat well, and everything will go back to normal and stuff. So it has a lot of overlapping. The three of them, they have a lot of overlapping symptoms that make people not pay attention or that make, like, at initial stage, you may not take it so seriously. You also have painful periods with fibroids, and you have painful periods with endometriosis. So if someone is having painful period, it doesn't necessarily mean that it's fibroid. Just so it can be anything. So it's just that laid backness that people feel like once there's a bleeding disorder, it's a normal thing that they just have to wait to ride out, and after a while it gets better. That's my challenge. I would like people to know that if you're having it, it's not normal. You need to go and check it, get early checkup, and then get treatment early, and you feel better. That's so that's
Oh, so literally, like that idiom says, a stitching time saves nine. So,
yes.
the earlier the better. It's essential for people to take their health seriously, uh, go for checkups, pick up, as soon as you see something that doesn't seem right, see it, say it, sort it.
Got it.
So, uh, one in three women globally face reproductive health complications. what are the biggest gaps in women's healthcare and what can be done to improve access and education?
Um, First is the stigma around women's health. Stigma, I would say the stigma, and then the other is cultural beliefs around women's health. The best way to overcome this is to increase the health promotion or like health education, create more outreach to let media to inform people. Not just now. I always want to say this health education shouldn't be restricted to the women only. It has to be everyone because the men are the ones that make the rules in a lot of societies. So if they are not aware of all these things, it's like you're wasting time. And then in some societies where women have to take permission from their husbands to do some things. For example, that the cervical screening, in some society, a woman has to take permission from her husband or from a male in the family. When I did the research, it was so shocking. A woman can't do some screening except they get permission from a male figure in the family. So if you now get a family where the man is not even aware of what you're talking about, they will just say no. If you're advised to go to take the HPV vaccine, and the man says, "Oh, it's like you're trying to sterilize my wife so she doesn't have more kids," you already have a lot of barriers and gaps. So you have to create culturally sensitive materials to educate the society in general, both men and women, and to reduce that stigma around men's health and the misinformation that is all out there.
I think that's actually a fantastic take. There is a growing movement towards holistic and integrative healthcare for women. So, do you believe this is the future of women's health, and how can women benefit from a more comprehensive approach?
Yes, I think it would help. First, the idea of screening ahead of time, just being aware, screening, and then having access to proper health care, would help to go a long way. So it gives that whole like everything. Just check giving access to proper health facilities, and also making it something that is not that taking off the stigma and misinformation around it. I think that would go a long way.
Okay,
So,
interesting.
and when you mean holistic, do you mean put the mental health, put the physical?
Yes, because you have the traditional versus the holistic healthcare models, right?
Yeah.
So yeah, so the holistic healthcare models is looking at a more comprehensive approach. You're talking
Mhm.
about both the physical, mental health as well. So we're talking
Yeah.
about health and well-being.
Hmm.
Yes. So in terms of misinformation, there's a lot of misinformation around contraceptives, menstrual health, reproductive rights, you know, these there's a lot of misinformation in the public space. So how can social media and digital media platforms, be leveraged to spread, factual and science-based, factual health education?
Okay. Well, I would say social media is it's an awesome tool to pass information and pass messages across the globe. But it can also have disadvantages because you now have people who are not qualified or who may not know what they are actually talking about. Just come up and just put up some kind of interesting information out there.
hmm
And
It's a
so
powerful
because
tool. I call it a
yes,
two-edged sword.
yes. And so because there's no one vetting those people online,
Mhm.
it just means anyone can just wake up and just put up whatever they want and say whatever they want. And now it's interesting that um, professionals have to compete with non-professionals in the way the information is passed. You may find someone dancing or saying something that is wrong, that would get more attention than you, that you're like, than a professional who is seriously like sharing information that is scientifically backed. People may not pay attention just because of the method. So it's a good tool to pass messages, but I would just encourage more professionals to be the ones passing those information, so that we can reach, because the aim is to reduce misinformation and not to increase it. Yes.
Oh, yeah. Speaking of misinformation, I am always very, very, what I say, upset. Yeah. Whenever I see, I say so-called influencers, right? And yeah, so-called influencers and, people in the podcast space like myself, not doing the quality research, just speaking, what I say, carelessly, right? In public space, and using terminologies that they don't even understand. So, for example, the other day I saw some girls, they said they're 32 years old on a podcast, and they were talking about, oh, that the mortality rate for men in Nigeria is 52 years old. I'm like, excuse me, you're trying to talk about life expectancy, not mortality rate. Mortality rate is a different, health, index, right? It's talking about the rate of death, right, in a population, probably the general rate of death or the rate of death due to a particular cause. So how do you go out there? And, a lot of people watch this, show. Sorry, but I think personally it is actually a shit show. To be as polite and, to let it, as calmly as I can let it. Anyways, they were trying to say, oh, a Nigerian man, 52 years old is the so-called, in quote, mortality rate, which is incorrect, right? Which is actually the life expectancy, you know, um, index they're trying to quote, and saying that Nigerian men that vape probably now have a reduction in, life expectancy by another 6 years, and probably if they've had sexual transmitted diseases, it decreases, blah, blah, blah. It's amazing, how young individuals, especially the Gen Zs, would take these kind of individuals seriously. And unfortunately, I am 32 years old as well. And I wouldn't blame, like a 21-year-old or 22-year-old, 25-year-old who sees a person like myself, right? And takes, me seriously for what I say, because apparently at 32, I should have some level of experience and, level of knowledge, right? By way of, doing certain things in life. It's really sad seeing these kind of individuals, influencing media, because whether we like it or not, social media has taken over traditional media, and social media has now come to stay as the mainstream media right now. So it's really unfortunate. I get really, really upset seeing people, that are meant to be authorities like myself, yourself, right? Now, anyways, they are not like us anyways. I'm sorry. They are not like us, because I don't think professionals will be misinforming people, right? But I think the only thing is they're probably millennials like myself and yourself. But it's sad, see millennials, acting, what I say, I don't want to use anything negative, but it's sad. Let me let it there. Let me let it there. I did make a comment on that post, and guess what? There was this, lady who now said, "I beg rest." I'm like, excuse me, like, what is it? Then somebody was like, oh, like, when somebody is correcting you guys, right? Because you probably like that influencer, you are not even taking the correction, you're not taking the education. And you know something, I was like, how I wish you only just checked my profile for you to know who I was, you probably wouldn't be saying I beg rest.
That's true. That's
Because
true.
I am very, very particular about, providing content that is educative and, insightful and inspirational. That is very, very important. And of course, we do our deep research. We bring on, certified, qualified professionals, to address, important issues. And that is why we have you today on the show. So speaking of, public health, you're welcome, and health equity, right? So health equity is one of your major advocacy areas. So
Mhm.
in what ways have systemic barriers prevented access to quality healthcare, and how can individuals and organizations work towards breaching these gaps?
Sorry, can you say that again?
I was talking about health equity, right?
Mm.
That is one of your own major advocacy areas. So, in what ways have the systemic barriers prevented access to quality healthcare, and how can individuals and organizations work towards bridging the gaps?
I first of all, I think by creating policies that would ensure that there's health equity everywhere, um, and also making sure that the basic health needs are affordable, if possible, free. But if not, if possible, like at least to get it to a rate that is affordable. Um, Also means that whatever intervention there we to want to make for a particular illness, we just have to put in the forefront those who are in the lower class, in quotes, to make sure that they are also considered when policies are being made. Like the screening I mentioned, let screening be accessible to everyone, both the high class and the low class. If it's possible, make it free. But I understand that some of these screenings, they cost a lot. For instance, the bowel cancer screening, while it costs a lot to make the kits and all that, and also to get to the point of colonoscopy and stuff, you have to pay staff, you have to do all that. If possible, if they can make it as affordable as possible, or if they can also make it free, if there's any way to do that. Polio vaccination is free, so that helped a lot.
Yeah,
Most
I think
times,
the Bill and Melinda Gates Foundation did work on that in Nigeria,
yes, and they
right? On
like
polio.
it really it did a lot of good. I was also opportune to go because they go from house to house to make sure they vaccinate the kids, and
Yeah.
so this
And I
time
think the
around you don't
Rotary
have to
Club
go.
as well did play a role as well, polio
Yes,
eradication in Nigeria.
yes. So it's actually that once if it's affordable and if it's free, and that way everyone gets the same amount of so they get equal service, and they have it so together.
Oh, interesting. So I see you're really, really proud of that achievement of making Nigeria a polio-free nation, and
Mm.
kudos to Bill and Melinda Gates Foundation, and of course kudos to an organization that I am actually a member of. I'm a member of the Rotary Club. They did
Right.
actually, yes, perform a lot of charitable activities and support in that initiative of achieving a polio-free Nigeria, and I am proud of to have been involved in that as well. Not just a numbers guy, not just a finance guy, but of course, somebody with that, kind-hearted humanitarian edge as well. And there's no such thing as service to humanity. And that's one reason why I always appreciate you healthcare professionals. You guys are overworked and underpaid, but it's a thankless job, and like they say, a teacher's reward is in heaven. I think a doctor's reward also is somewhat in
Yeah.
heaven. Well,
I think
you guys want your reward on earth right now.
I think another reward we get on earth is the fulfillment that comes with seeing your patient healed and happy.
Mhm.
So
Mm.
there's a special kind of fulfillment that comes with it. So that's also a rewarding. That's also another form of reward. So
Wow.
but for me personally, I feel fulfilled whenever I see a patient that I watch, like I took care of from
Mm.
their worst states, and then they feel
Mm.
better and they're happy moving around. I got an opportunity they named the child after me, Ivy, when I
Wow.
was when I was in
Ah.
Abuja.
Oh, wow, interesting.
The baby went through a lot, and then afterwards, from birth, immediately the baby was born. I was the one taking care of the baby. Then after all the struggle and the hassle, the mom named the baby Ivy. So whenever they come for follow up, they just say, "Oh, Ivy's mom is here." I'm like, okay.
Oh, interesting. So, just on a light note, was Ivy ever on an Ivy? Because that is something I always say to you, Dr. Ivy. Does Dr. Ivy need an Ivy, right?
Ivy.
It's actually a very big honor, right? To have somebody name their child after you. I think I did experience that as well 2 years ago, and somebody did name their child Ademola because, of how much they appreciate me. And it, would I say, made me feel humbled, right? To a very large extent. So you and me, right, having experienced something similar, I'm curious, what emotions, ran through your mind at that point in time.
Um, so I always say, as a doctor, we go through all the emotions you can think of, like every other person. Sometimes you think that doctors are hardened, or they don't have emotions. They just
You
come to
guys have a
work.
good poker
Y-
face.
Yes, and then you can just watch someone die and just move on and all that. But the truth is, we
Mm,
actually think it affects us a lot. So, and there's sometimes it takes a toll on your mental health,
mhm.
the fatigue that comes with being a doctor. But you have long shifts, 12 hours stretch. You're working during odd hours while others are sleeping. You're awake. You have to be awake and alert to make the right decisions, to be
Exactly.
active and all. So it comes with a lot of mental stress and a lot of physical stress. But
So, lot.
imagine at the end of it all, after going through all the stress and everything, you see the outcome. You save the life. There's no other better feeling than that. It just makes you feel like whatever you were doing, the stress you were going through, whatever thing that happened was worth it. You didn't
Mm.
waste your time. Instead, you saved your life. So that's the fulfillment that comes with it. We go through a lot mentally, but that whole idea of seeing it through, like the person from looking like they were gonna die, and then seeing them get better and well, it it makes the journey worthwhile. They said the end justifies the means, so yeah.
Mm. And justifies the means. I've forgotten what philosophy that is. I think Machiavelli, if I stand to be corrected, but I think that's Machiavellian philosophy. But lest I forget. There's this joke about doctors where they compare doctors and teachers. They say the mistakes of the teachers are roaming around the streets, or the mistakes of doctors are in the graveyard. So it is a lot, on you guys. Like you said, you have to stay, active. You need to stay mentally aware in order to ensure that you are making, the right decisions, making well-informed, judgments. because the risk, you know, of making a judgment that is not well informed, that is not sound, is actually way higher than what it is in other professions. And I think that's one reason why you guys are highly respected, anyways, in society. But I think for me, I put you guys on the highest pedestal because service to humanity, in my opinion, is the highest level of service and highest level of dignity you can achieve as a human being. And uh, I feel envious of you, so I would like to be a doctor when I grow up. When I grow up,
I hope so.
I'll try to be
When
a
you
doctor.
grow
I want to be like you when I grow up. So you touched on telemedicine earlier and digital health tools, you know, and how they help in expanding access, right? So do you see this technology as a game changer for reducing health disparities, particularly in underserved communities?
Yes, I think it would help a lot um, to bridge the gap, but it's also about them having access. I'm all about access. If they don't have access to these, then you may find it available among a certain class of the society. So telemedicine, if telemedicine can only work with someone who has either a good phone or laptop,
Mhm.
and they have the literacy, they are literate enough to operate those equipments. In the Western community, yes, telemedicine is everything. The AI-driven diagnostic tools, oh, they're perfect because everyone understands it. But I've been opportune to I schooled in the Caribbean. I'm now in the UK. I worked for about 8 to 9 years in Nigeria.
Wow.
Um, I have a special interest in making everything equal, making everything universal. So the experience we're having in the Western world, I'd like to see that replicated in developing countries, in India, like Asia, in Africa. So every time I speak, I always talk about Africa because I'm trying to kind of throw light towards Africa. Um, Obviously, Nigeria is not it's not, I don't call it a poor country because we have a lot of educated, we have well, cities that are is well developed. But I'm also speaking for those cities that are not developed, other countries in Africa that are not, as developed, and they may not have access to, constant electricity for telemedicine to be a thing. So
Mm.
telemedicine actually is supposed to be you having access to conversations with your health professionals at the comfort of your home. And you can only do that with technology. And technology is powered by electricity. So you have to have all those things available for you to be able to use telemedicine properly. So that's why my advocacy is usually let's spread it across. Let's make it universal. It's doing well here. But what about these other places? Let's throw more lights there.
Mm, interesting stuff. So speaking of our policy recommendations, so if you had one major policy recommendation for improving healthcare equity, what would it be?
I always fix universal screening, free screening everywhere, screening services everywhere. Let's have a policy and let's have um policy and program that everyone has access to screening, routine screening, free, if possible, across the globe, just universally, not just in certain areas.
Oh, early detection helps in early prevention, and prevention is better than cure.
Mhm. Yes.
Mm.
And
Okay,
you can only get early detection from routine screening. So
exactly.
when you screen routinely, you'll be able to detect it early, and then
Mhm,
prevention comes.
mhm. So you cut my drift.
Mhm, mhm.
So, empowerment, practical advice, right? So, what three essential health habits would you recommend that everyone practices regardless of age or gender? What should people listening to us, right, regardless of their
Um,
gender, adopt immediately for their healthier future?
I would say in this era where people lack sleep, 7 to 8 hours of sleep, one,
So sleep, adequate sleep, 7 to 8 hours of
adequate,
sleep. So
yes,
number two would be what?
exercise,
Exercise. How many minutes of
exercise,
exercise?
at least 30 minutes of exercise.
Okay, at least 30 minutes of exercise daily. And what else?
Then I would say, find ways to manage stress
Okay.
through intentional relaxation techniques like yoga. Just stress management actually goes a long way to solve a
Stress
lot.
management. Oh, interesting. The way some people manage stress is by putting on their social media stories. I am too blessed to be stressed. And that's
What did your
Lord is
pastor say?
that is it's a stress management technique. Feeling too blessed to be stressed, but gratitude, I think, is and positive affirmations are actually very important also
Yes.
in like helping your
And,
your mental
and then
well-being.
also not to compare
Mm,
yourself with people. Just be
mm,
content with
yeah,
yourself.
yeah, very, very, very true. Yoruba people say mafia gualago shishe, meaning don't work with another person's clock. You know,
Mhm. Mhm.
yeah, everybody's time, is different. Life is a marathon, not a sprint. Yeah,
Mhm.
some people, and our people will always say overtaking is allowed. Some people will overtake you, and down the line you'll overtake them, but you're not, running other people's races. We're all running different races, and learn to stay grateful. Regardless of the phase of life you're in. I interview a lot of combat sports athletes, and in combat sports, martial arts basically incorporates discipline and respect, right? So in victory, it's important to stay grateful, and in defeats, it's important to stay graceful, and
Mhm.
that's makes you a well-rounded individual. I hope you agree with me on that.
Yes, I do. It's actually, I'm going to keep that. I'm going to make note of that. So.
Ah, interesting stuff. I'm happy that I can have some level of influence, on
Mhm.
my role model, because I want to be a doctor in
Be
future.
dogs
And
in the future.
so, your work, and of course, your body of work so far, and you have a book upcoming, right? So your work empowers women to take charge of their health. So what are some small actionable steps women can implement today to be their own health advocates?
The first is track the menstrual health, to be like pay attention to their menstrual health. Also to get more informed on women's health. Read
Mhm,
wide.
mhm,
If you're not the type who would like to read, that now that there's social media, there are lots of video contents that are from trusted influencers, so trusted
mhm,
professionals rather.
mhm.
Get informed and just go for routines. Go do your routines, tests and screenings. That's just it.
Interesting. I think nowadays we have professionals who have actually become influencers as well. I think in
Mhm.
Nigeria we have the likes of Aproko Doctor.
Apricot doctor. Yes.
Yeah, I think I see him from time to time.
Mhm.
People are so tired of the guy always recommending what to do and not to do. But I think
Mhm.
I don't know. You will be in a better place to assess him. But for me, I just think he has good intentions
Yeah, he
somewhat, and
does.
yeah,
He
and I
does.
hope he's able to make that impact he's out there to achieve. Oh, you talked about culturally. aware techniques of achieving, public healthcare initiatives earlier. So, but in many cultures, taboos around women's health still exist. So, what advice would you give to young women struggling to access factual health information due to cultural stigma?
First, uh, the first step is knowing that there's just having that hunger to know the right thing, to get informed, would be able to drive whoever that is, or drive the person to get information from trusted sources. So yes, some people may get their information from either the traditional rules or the religious rules that they are used to, but also thinking outside, trying to get information out there, listen to trusted professionals on, like, social media is everywhere now. You can always get your information from social media. Find somebody who you trust that is in women's health, and then also just listen to them. Someone like me, if you can, just just be open to information, just be open to learn, and you'll be able to get the right information.
Mm. Yeah,
Because
it
sometimes
seems.
these traditions these traditions actually put people in a box that they don't think outside it. But once they are aware that there's something else outside that box, then they will be open to get more knowledge and information on their health.
Mm. Yeah, I was going to say that it is actually important that, we connect with individuals like yourself, um, passionate, professional, well informed, and of course, also willing to help. It's a unique combination of characteristics that helps, you know, to achieve impact. So I would say, so let me quickly use that opportunity to ask, how people can connect with you. I know you have an Instagram profile, right? What's the best way to connect with you? Instagram, LinkedIn, like what platforms are the best to connect with you?
So the fastest for now is the Instagram. That's divhealth.com. Sorry, div health. And then also I
Oh,
have a blog where you can contact me. My email address is attached to it, and that's
okay.
divhealth.com. I also have a YouTube channel, but it's still being set up. But Instagram is faster at the moment, and also my
Okay.
blog, health blogs.
Okay, I will include the links to those contact platforms in the description of the podcast. So you can actually contact Dr. Ivy via Instagram, via her website, via LinkedIn, and the links will be provided in the YouTube description. And of course, regardless of wherever you're getting the podcast from, Spotify, Apple Podcasts, Amazon, Google, it is going to be in the podcast and description below. So if someone only had 5 minutes per day to focus on their health and wellness, what's the most impactful thing they could do?
Um, 5 minutes, manage stress.
Manage stress. And of course, what's a common health myth that you wish more people knew was completely false?
That infertility is only a woman's problem.
Oh, wow. Interesting. I like that. I like that. So, before we let you go, we know that you're a very busy woman, but we want to play a quick game with you regarding quick health myths. So, it's a buzz around, it's interactive, it's fun, and it's driven for engagement, right? So, I'll say statements, and you tell me if it's a fact or a fiction.
Mhm.
Are
Okay.
you ready? So, before I start, let me drink my water and mind my business. Because number one question is drinking 8 glasses of water a day is the absolute requirement for everyone. Fact or fiction?
Fiction.
Okay. cracking your knuckles causes arthritis. I crack my knuckles a lot. I'm on this table.
It's
And wait,
fiction.
thank gosh.
I've heard
That
that
is
thing
a
so many
that
times.
is
It's so annoying. It's fiction.
thank God. I was waiting for it to be a fiction. I'm happy now. God bless you, Dr. Ivy. So number three, skipping meals helps you lose weight faster. Fact or fiction?
Fiction.
Okay. So you can sweat out toxins through exercise. Fact or fiction?
Fiction.
Wow. The fictions are a lot. Eating late at night automatically leads to weight gain. Fact or fiction?
Fiction. Definitely, if anyone wants to get to know the explanation behind why I'm saying fiction, then they can always reach out to me and I'll be able to explain. But it's
Okay.
actually fiction. Yes.
Wow. Interesting stuff. So, number six, if you swallow gum, it stays in your stomach for 7 years. Fact or fiction?
Fiction.
That is a
Yes. Oh no.
that is a fictitious fiction.
That's
So,
fiction.
okay, I guess my research team had to give me this one to make us laugh. So, number seven is vaccines can make you sick with the disease they are meant to protect against. Fact or fiction?
That's fiction. Sorry.
That is fiction.
Can you hear me?
Uh, a little bit.
Sorry, it's Charlotte. Can you hear me now?
Okay. Yeah, I can hear you correctly. Yeah, I can hear you
Okay. So
clearly, rather.
it's fiction because vaccines are made of inactivated, like inactive viruses or bacteria. So they
Mm.
just use it
They're like dead
for
cells.
yes, so like the weakened form of the virus. So it's
Oh,
just
okay.
introduced into the body for the immune system to practice to train on how to fight the
Oh,
actual illness. So it's fiction.
mm, in combat sports, we call that sparring. So you're training for the real fight. Okay, interesting. Carbs are bad for you and should always be avoided. Fact or
Yeah.
fiction? Okay,
Fiction
even if
because carbs you need carbs for energy. So yes, we have complex carbs and refined carbs. It depends on so we're trying to take out refined carbs, but you need carbs for energy.
okay. So anyways, even if you do a fact, I'm sorry, doctor, I think I can't go without carbs. I think there was some time I tried to join somebody on their diet, and then they were like, "Oh, eating salad and stuff." I was feeling so faint, as if I was gonna fall. While walking on the road, there I went to eat my carbs immediately.
Mhm.
Excuse me, I'm an African man, and Africans, we love our carbs, we love our carbs and our proteins. It's an essential part of our diet. So, you only need sunscreen on sunny days. Fact or fiction?
I know it may sound strange, but that's fiction because even when it's cloudy out there, you still have 80% of sun rays coming through the cloud.
Okay.
Yeah.
Okay. Interesting
I
fact.
decided to explain more so that people would understand
Yes,
why I keep saying fiction. Yeah.
I understand the context, and that's very
Mhm.
much appreciated. So they say a detox tea or juice cleanse can reset your body. Fact or fiction?
You already have your liver and kidney doing all that. That's fiction.
Oh, interesting. Hmm. So
Why
we
mess up
have
your show?
no, no, that's actually interesting. I appreciate that. No, come on. Kidney and liver. Okay. I was just thinking, about, yeah, how about people with liver transplants and maybe 40 kidneys or 40 liver functions?
So that's the thing. It's
Does
the
that help
function of the
them?
liver. Yes, the function of the liver and the kidney is just to detoxify, to remove toxins. So, saying that a tea or that's the work that's what they like. That's the work of the tea. You already have your, but it's just you're trying to do something that you already have naturally. And for someone who has a liver transplant, like you said, I don't think recommending tea will be the best idea because for you to, if you're taking anything you take into the body, the kidney helps to select and save. So if the kidney is not functioning optimally, introducing that thing is going to be very will not be wise. It's just is for example, if you have a mansion and there's security breach, you wouldn't want to introduce things when you know that you don't have enough manpower to fight if there's any problem.
Okay, so am I correct to say that it is somewhat of a biological filtration or distillation process? Is that
So
correct?
yes,
Is
so
that
it's the physiological function of the kidney and the liver is that's what they do to detoxify. Yeah. So if they're not functioning properly, they also even the medications we take, they also get screened through the kidney and the liver or the liver.
oh, yeah.
So if you're putting in a medication in quote that's in form of a tea to detoxify, they also have to screen that foreign body you're putting in. Well, if it's not functioning properly, why are you adding more work? Why are you sending them more things?
Okay, okay, interesting. You have actually provided us with a sea load of education in terms of healthcare today, and I don't know how to thank you enough for your time. I like to tell people that life is measured in time, and when somebody shares their time with you, they have shared their life with you. So a very, very big thank you to you for sharing your time, your life. You sworn the Hippocratic Oath and you are very passionate about, public health and, achieving impact in terms of, healthcare initiatives. And that is why you're actually taking time out of your very busy schedule to be on here today. Uh, Before I let you go, I know there's a cat in the bag that I'm going to try to let out, even though they say curiosity, killed the cat, right? So let's give a challenge to the audience, right? So the challenge to the audience, if you're listening to us right now, is if you could make one small change today to improve your health and well-being, what would it be? Please drop that in the comment section. We want to see it. And of course, not just me, Dr. Ivy would like to see it. And of course,
Yes.
let me take a moment to talk about our merch. This is the King
Oh,
Dems
nice.
Podcast Heart, and of course, Dr. Ivy will be getting a free copy. And of course, we're launching the store soon. I hope you like this. It's in collaboration with
Mm-hmm.
a brand called 36 Label. So you have King Dems written in front. TKDP means the King Dems Podcast. And of course,
Mm-hmm.
36 Label coming to you soon. And of course, Dr.
Thank
Ivy,
you.
say less. Just send me your mailing address. And of course, you get this in your inbox pretty soon. So
Thank you.
you're welcome. And yeah, for me, I should be saying thank you. It's interesting, we're both saying thank you. Anyways, thank you. In Nigeria, they say don't thank me, thank God. Right. So it's been a really, really, really amazing session today. And of course, one more question before you go. Imagine you have $10. We don't spend dollars here, we have spent pounds. So imagine you had £10 to spend on your health today. How would you spend it wisely? That's a question to the audience. You guys should try to impress Dr. Ivy, right?
Mm-hmm.
Let's see how you can spend $10 or £10, right? Wisely in terms of your health. And of course, for me, it is love and respect And of course, another thank you to Dr. Ivy. Dr. Ivy, do you want to leave a shout out to anybody before you say goodbye?
I just want to say thanks to everyone who listened to today's episode and who also listened to the King Dems podcast. I'm definitely sure you're getting quality information from these episodes and either finance, health, or other topics. Because Ademola that I know is very particular about passing the right information.
Mhm.
And I also recognize the time you take to make sure you get quality guests that you're sure
Thank you
would
very
pass the
much.
right, yes, I'll pass the right information. And so, please, if you have questions or if you have any misconception about any of the information that we've passed through today, feel free to drop questions and then I can elaborate and explain further if you want. Um, I'm very excited that to hear this episode. I look forward to coming back again if I'm invited.
Yeah, you
Um,
are coming back again because I almost forgot to let the cat out of the bag. You are publishing your book soon. So once that book gets published, you are automatically re-invited. Our people say if you don't get evidence, you go explain tire. So this
Mhm.
is evidence, you have been re-invited by the powers conferred upon me. Back to the King Dems podcast once that book is published. So do you have a timeline for us, or you just want to keep us waiting and guessing?
I would say I'm looking at towards May, but
Okay.
I'll keep you posted and I'll let you know when it
Okay.
comes out. Yes.
Okay,
Um,
interesting. May we see it in May.
yes.
Huh. I just thought about it. Like I have known you since 2016 or
Yes.
2017. Wow.
20,
Mm,
2016.
2016.
Yeah.
Wow, ish. Wow, that's a long time. And
Mhm.
of course, I have only good words to say about you. Amazing individual, consummate professional, uh,
Thank you.
and of course, amazing Christian as well. Uh,
Thank
Person of
you.
faith. Yeah, so excellent character. I'm really glad. I'm blessed to have you on the platform, and of course, I hope that the audience have been able to benefit immensely in terms of education and inspiration today. And for me, goodbye. God
Thank
bless you
you.
guys.
Thank you.